people aren't really talking that much about this, as far as, most people just kind of keep this to themselves. Whereas, when somebody has chronic pain, that's something they often share with people. But if they're dealing with anxiety, depression, they keep that quiet. But we're really dealing with a major epidemic in our society, aren't we?
Oh, absolutely. And, it's so sad that now in America, mental health is really in a crisis, particularly now after the recent pandemic. We have seen suicidal rates go up, depression, anxiety go up, and with it, crime. So let me share with you some quick statistics on mental health here in America. 1 in every 5 Americans will have a diagnosable mental illness or mental condition at any given year. And almost 50% of Americans will meet the criteria for a diagnosable mental condition sometime in their lifetime. Just think about that. That's super duper high. And half of those people will develop conditions by the age of 14. These are sobering statistics and how prevalent mental illness is. And if I may share the definition of mental illness according to the American Psychiatric Association, it relates to illnesses that change emotions, thinking, behavior, and a combination of those. And mental illness are associated with distress and problems functioning in social work and family settings. And among these are mood disorders. These are the more known disorders such as anxiety, depression. And then you have things like psychosis, OCD, schizophrenia, and some experts classify Alzheimer's, autism, ADD, and ADHD as mental illness, as these disorders come with a behavioral and emotional changes. Now, when you come down to it, anxiety disorders are among the most common mental illness in America. Generalized anxiety, OCD, phobias, PTSD, all of these fall into this category.
Yeah, for sure. And, in the medical system, when somebody has these kind of conditions, they tell people, well, I think you have a chemical imbalance, right? And that's kind of the main theory that they've gone about with. But, I know you and I have looked at studies and research, and there really isn't compelling research.
There's so many disorders to mental illness with different symptoms, treatment, risk factors, prognosis, and so forth. And you mentioned like the prevalent belief or theory of mental illness is a chemical imbalance. Absolutely. And I think we all can relate to that. I was told that the reason why I was suffering with mental illness is because I had a chemical imbalance. So it had to be solved with another chemical. And so there are two theories, or let's name it theories of mental illness. The first one that you mentioned is that mental health is caused by a chemical imbalance. And like you said, this is mostly held in the traditional mental health model. The second one you also mentioned, mental health is caused by inflammation. And this model has emerged in the last 10 to 20 years. And this really is the most promising. So generally speaking, in the traditional mental health model of mental illness is a chemical imbalance that may be treated with medication to balance brain chemistry. For example, in the case of depression, the major player would be serotonin. In the case of anxiety, would be GABA. And in the traditional healthcare system, is usually composed, the treatment is usually, medication. And there's times when complementary and alternative therapies are used. So that is typically how, treatment is done with this model. Now, it's interesting that in this model, the risk factors are as follows: genetics. You heard that. Well, I have a family of this illness, therefore, it's very likely that I will have this, that, or the other. So genetics, trauma, stress, substance abuse, prenatal damage, brain defects, or injury. So at the end of the day, the prevalent form of treatment are drugs and therapy. Mm-hmm. And typically, and this happened to me and it happens to a lot of people, typically when an individual is prescribed a medication for mental illness, They're told this treatment is a lifetime.
Yeah.
Okay. So that's what I was held to believe, that until it got so bad that I go, oh my goodness, there must be something better than this. So in short, the working theory in the traditional mental health model is that chemical imbalance in the brain is due to either a deficiency or an excess resulting in mental illness. Now, I like to give you a side note. I would like to say that there's a place and time for medication. And I will be the first to say that I'm thankful that it saved my life. Mm-hmm. If you're currently taking medicine under the care of a physician, please continue taking your medication until and otherwise indicated by your prescriber. I believe this is so very important, because mental health and mental illness is so, a lot of things, if you don't know how to tackle it, if you're not under a care of a physician, practitioner, you really need to be careful, not take things onto your own hands. So
yeah, because it could be dangerous to just come off of some of these medications, because your body starts to downregulate. Like if you're taking a SSRI or a serotonin reuptake inhibitor, your body starts to downregulate, and starts to change the dynamics inside of your brain to be able to respond to that, right? And actually,
Absolutely.
and it can start to reduce the amount of serotonin that's produced, and therefore you can have some pretty significant side effects if you come right off of it cold turkey.
Their brain has changed, their chemistry has changed, but they also have not changed the root causes. So it's very difficult to get off of it. And that's one of the reasons, because it's really true. You kind of are stuck with it unless you make some changes. Because like you said, your brain changes, and it is very dangerous not to do it under the supervision of your physician.